think you had quite a few people. You had a few people on that floor as the reports come out that were positive. You get a viral burden, ventilation issues, and presumably a more contagious virus. So all that recipe together just makes hotel quarantine risky, and just got to be completely alert. And clearly this person did the right thing when he had a negative test, but when he got symptomatic, he came forward for testing, but has travelled quite a lot around Melbourne.
How did he get it there?
Well, I just don't think you have to invent anything new here. It's quite likely it was in the air. Even with checked ventilation and so on, you don't have to be within 1.5 metres. You can breathe in the air. The studies in Melbourne and Western Health showed that even when you think the ventilation's good, it can be venting several metres away to a nurse's station in that case, and the nurses get infected, even though they didn't do anything wrong. It could be in the doffing of the PPE, if he was wearing PPE and just lost concentration. It'll be one of those things. It's just, this is a very contagious virus, and it's getting more contagious.
So given that this happened in Melbourne and this worker was out and about in the big cities, you say, does this add to the argument that return travellers should be quarantining outside big cities?
Well, it just continues that argument. It's a huge issue. I mean, just imagine you're Dan Andrews or Gladys Berejiklian, and you've got all the systems set up, albeit Sydney's had 3 leaks, if you count the Avalon one. Melbourne's now had 2 in a couple of days, and the risks associated with that. You've got a whole infrastructure, management infrastructure, to actually transfer that to a regional centre, Bendigo, Ballarat, or Tamworth's put its hand up for their flight school. It's just really hard. You've got to retrain, and every time you transport people, you're not going to get Emirates flights landing in Tamworth or the country airport at Ballarat. They're going to land in Melbourne or Sydney and then have to be transported. And every time you move, you create risk. So it makes sense. As far as I'm aware, we haven't had any leaks from Howard Springs. If they have, they've been kept quiet. So it does make sense. But in Darwin, they land in Darwin and they go by bus to Howard Springs. Here, it would be 2 transfers and not an easy thing to do.
Victoria, as we know, is very good at contact tracing. They've had a lot of practice at it. But this hotel worker's young man, as you say, was active in the city. He went to a lot of places. How concerned are you that this is just the start of another outbreak? Well, the question here is with this man is he the first source, or is he actually a secondary source from somebody else if you go back 2 or 3 days? So in other words, is there a little cluster out of the Grand Hyatt which actually this person caught it from, rather than directly from people who were living in the hotel under quarantine? So that's the first thing. So if he's actually a secondary case, it's more worrying than if he's the primary case. But then, they will get onto it and sort it out and get it on pretty quickly. And there'll be lots of people around Melbourne going into quarantine, 14-day quarantine, because they're close contacts. And if they do become positive, the goal is they become positive when they're in quarantine because they've already been isolated. And we've seen that with Black Rock, and we saw that with the Avalon outbreak as well. A lot of people became positive in quarantine. That's where you want to be. Daniel Andrews has imposed restrictions. He hasn't imposed a lockdown, though. Brisbane imposed a lockdown. Perth imposed a lockdown. When we spoke to you on Monday, you said that Perth did exactly the right thing by doing that. Yeah. Melbourne, no?
Yeah, I think you've got to take the whole context here. So yes, they knew that they had a more contagious virus in both Brisbane and in Perth. But equally, they had populations, communities, which had not been socially isolating for months. Queensland's a bit of a different kettle of fish, but nonetheless. And they had contact tracers who were being fired up from a standing start. So it'll take them a couple of days to get going. And whereas New South Wales and Victoria are battle-hardened, they're on the alert, they're on edge, ready to go. And when you're just not sure that your contact tracers are right on it from the first hour, then it makes sense just to lock down for a little while, let them get going. They're good, but it's from a standing start. I think that it's that sort of context that you've got to think through.